Okay, good morning. So today we're going to have a teach back on the chapters we're assigned for you to read, which includes conditions affecting the nervous system. And of course, we're going to talk about strokes, Parkinson's disease, multiple sclerosis, okay, and Guillain-Barré syndrome. We're going to also discuss topics on arthritis, such as osteoarthritis, rheumatoid arthritis, gouty arthritis, fractures, which are important topics because you as future nurses will definitely encounter, right? So let's first deal with, so if you were to study, you have to prioritize which one is important, which one is life-threatening, okay? So probably arthritis is not as important as when you suffer from a stroke, right? Because obviously the organs involved are totally different. In arthritis, you only involve the joints. But in a stroke, what part of the body is affected? Human brain, right? So when we're dealing with the human brain, it's important because that's actor of, obviously, aside from the heart and the lungs, of all the organs that you have, you want to preserve the brain, right? Now, the word stroke is a layman's term. For human people with strokes, eventually we know that the brain is involved, but in the field of nursing and medicine, we use a different term. What is the term we use? Okay, CVA. What does CVA stand for? Okay, Cerebral Vascular Accident. So the bottom line is that in the process of learning, we always try to learn the words that are used, and we need to be able to define terms. So when you hear the word cerebral, what organ is involved here, class? Brain. And then when you say vascular, what is in the brain that's important, affected? Huh? The what? Vascular means what? What part of the brain is affected? Which structure inside the brain is affected? Anyone? Say vascular. Yes, Miss Smith? The veins. The veins, okay. Is that the first thing that comes to your mind? When you say vascular, you talk about blood vessels. Is the vein the most important blood vessel or the artery? There you go. So when you're thinking, your thought process should be fast, should be sharp. Okay, I'm not saying your thought process is not sharp right now, but I want you to develop that kind of what? Thinking process. Should be fast, sharp. So why is the artery more important than the vein? You know the reason why. Why, my dear?
Oxygenated blood.
Oxygenated blood. See what I mean? So you mentioned the vein. Why did you mention the vein when you could have said artery, right? See? Do you understand what I'm saying? Why is it important to think fast? Because your nursing board exam is under time constraints. You only give, based on my calculation, with 265 questions asked, and you're only given around, with 265, around 90 seconds to answer every question, right? So apparently with 6 hours times 60 is 360 minutes, and you're supposed to answer 265 questions, 90 seconds, based on my calculations. So to answer a question, it takes 90 seconds. Now how about reading a question? It may take you more than that, right? That's the reason why I want my students to think fast. And cerebral means brain, vascular means cerebral arteries are involved, and accident, is it really an accident? What do you mean by accident? Well, in this case, it's not a proper term. Some books use the word cerebrovascular disease rather than accident because the word accident is quite misleading. You could think of accident, car accident, whatever. You fell, it's an accident. But in this case, it is either what? What are the two types or general types of strokes that we are aware of? Anyone? Yes? Hemorrhagic and ischemic, right? So if I write the word CVA here, I already introduced to you the word concept maps, right? Concept maps. How many of you have subscribed to my Joel Gamo MD YouTube channel? Okay. Why is it important to subscribe if you have a chance? Because you can see all what? Anatomy and pathophysiology videos, which means it's free. And you can watch it as much as you can, play it, and you can even watch it on what? On your cell phone, right? See? I'm not trying to advertise this website, but You go to YouTube, you type what? Joel Gamo MD, and you see even the one last. How many of you saw the teach back I did last Tuesday for the Tuesday class? There you go. So don't tell the other class. You're better off because you were able to see the teach back I did for them, which is now being shown for your class, right? So I would probably think a Friday class is better than a Tuesday class, right? But now with all these videos present, then they can watch all of these until the next term and the next term, right? Okay? So the bottom line is that I wrote here stroke, which is today, and I'll be doing the same thing. But sometimes there are things that I may add that are not here, so that's why you pay attention still, right? So apparently we talked about CVA, a concept map. So in that website, you can actually go into that. How many of you saw that lecture I did for the faculty members of West Coast called Concept Maps? You didn't? Okay. I would suggest if you have a chance, watch that video, because in that video I am sharing how to learn to the faculty members and how to make our students learn better, more organized, and more effective of learning using a concept map. So when you use a concept map, it's an idea map. You have to break down words, ideas into a highly organized way. What is a map for? A map is designed to what? Guide you so that you can reach your what? Reach your what? Destination, exactly. And our destination is for you to learn. And not just learn, but what? Effective learning, to be able to learn as much as you can, right? Your goal is to know as much as you can. I don't even mind if you know more than me and know more than anybody else in this world, right? Because your goal is to be the best that you can be, right? Okay? So, ischemic stroke versus what? Hemorrhagic. What's the difference between these two? What is found here that is not found in hemorrhagic stroke? Give me the word. Yes? A what? Somebody said something. A what? Okay, very good. I'm just trying to repeat. Repetition is the mother of all retention. There is a what? What kind of clot? A blood clot. Okay? A blood clot. Now, there are two types of blood clots, as you already know, right? One of them is stationary. Which one is stationary? Thrombotic, thrombus. And which one is a traveling blood clot? Embolic. So you notice, what did I do in this kind of concept map? What did I write on the whiteboard?
Keywords.
What kind of words, Miss? Yes?
Keywords.
What did you say?
Keywords.
What did you say?
Keywords.
Of course! Because by writing down keywords, hopefully you will also retain what? The keywords that you're supposed to retain in your brain. You do not want to make your brain a what? Did you see that thing beside the door? What is that thing? Trash can. A lot of times people read, memorize things that are not important. Believe me, I'm still a student up to now, but oh my God, I read, I study everything, and my score is still 50%, 60%, because that's not what you call smart learning. What is smart learning? Trying to know which one is important, which one is not. At the beginning of its book, at the chapter, it says, at the end of this chapter, the student must be able to, 1, discuss, explain a stroke. 2, discuss, So that is actually what you're supposed to know. How many of you go over that in detail? I don't think so, right? But if you really go over that of your notes, and most importantly, understand and come up with something like this, then there's really no way you cannot get an A in this class. And whatever you do in the future, whether it's going to be here or core nursing, okay? So, thrombotic stroke. What is the pathology here? But essentially, I have to go ahead because we have limited time. This is the brain, right? The human brain. This is the spinal cord here, passing through the foramen magnum in the occipital bone. Okay? So, apparently, if you remember, from the heart, this is the heart, this is the left ventricle. It doesn't look like a heart, but it is the heart. Aortic arch, right? And the blood flows from the left ventricle to the ascending aorta, aortic arch, and then you have what? Left subclavian artery, and then the left common what? Common carotid artery. On the right side here, you have the what? Brachiocephalic, which you do not find on the right or left. The brachiocephalic artery divides into two. The right common carotid and the right what? Subclavian. So it's essentially the same on the left, except that on the right you have a brachiocephalic artery. So now the question is, how important is anatomy in the things you do as nurses? It's the foundation of nursing, the foundation of medicine. When I teach the medical students at UCLA, when I teach the nursing students here, it's the same thing. We have to deal with the same anatomy of the human body. They're doctors, you're nurses, you work together, but expect the same thing as you and them to know these things. Now look what I did. Now how many of you have a whiteboard at home? Only a few people have a whiteboard. Did I not tell you to buy a whiteboard? Why is it important to know, do a whiteboard, do what I do here? Because this is probably the best way to do learn. Because when you do this 10 times a day, will you forget? You won't. Now why is it necessary to know the anatomy of the heart, the left ventricle, the aorta? Because this is going to guide you, how can the blood reach what organ? Because that's our topic for today. So apparently when the left ventricle pumps blood, it goes where? To the left common carotid passing to the aortic arch. And then what? The left common carotid divides into two. Internal and external what? Carotid artery. Which do you think will go to the brain? What? Of course, internal is inside. External goes up here because maxillary temporalis artery, facial artery, external. But our main concern is this, internal, because it's the one goes where? And what do you call the arteries of the brain? Yes? Huh? Cerebral artery. There you go. Don't you love anatomy? What does cerebral mean?
Cerebral.
Brain. So if I say you are a highly cerebral person, Miss Roberts, what does it mean?
You're a very intellectual person.
You're very intelligent, right?
Intelligent.
Even though you came in late, but it's okay, right? You're very smart, right? If I tell you that, it's a compliment. Miss Roberts, you're very cerebral. You're very intelligent, very smart, right? Do we want our students to become very intelligent and very smart? Yes, because we're dealing with human lives. A student does not study, I don't think that person will become a good nurse. A student who does not have the passion to learn, the passion to take care of people, if you're not even able to concentrate and study for these subjects and this class, then you have to reconsider, am I really going to be a good nurse? Do I want to be as passionate as I can be? So the start of developing the right attitude starts here in the classroom. Because you need to know all these things because you're dealing with an actual patient who could die if you do not do the right thing, right? Okay, so in a thrombotic stroke, apparently the artery has the three layers: tunica intima, media, and adventitia, right? The lumen is where the blood will flow, correct? Now look at me. What do I have here?
Fat.
Okay, you used to have six packs and a 1 pack of fat, okay? So where do you think this excess fat will go? Deposit everywhere. Will that include the arteries of the brain? It's called atherosclerosis, which we learned before, right? Atherosclerosis is nothing else but the deposition of fat in the wall of the tunica intima of all the arteries in the body. It could be the arteries in the leg, arteries in the heart, even the coronary artery, so it's called coronary artery disease. What is the pathology? Atherosclerosis. Can you have atherosclerosis in the cerebral arteries? Yes, you can. So as this is going to get bigger and bigger, what happens to the lumen? Smaller, remember? We talked about this, 8NL, the Possel's law. Apparently, as time goes by, what is the word that means decreased blood flow to the brain cells? It's called ischemia, just like in the heart. It's called myocardial ischemia. What did the patient manifest with? Angina or chest pain. The same thing here. When there's decreased blood flow to the brain, will that affect the brain's function? Of course, right? Right? And we know that the brain has many functions. The frontal lobe, particularly what? Which part of the brain is the motor cortex. Motor means muscle, controls movement, right? It's in the frontal lobe, the precentral gyrus of the frontal lobe. Sensory, the parietal. Where did we learn all of these? Anatomy and physiology again. You see what I mean? So, decreased blood flow. Now, the thing is, there's a difference here. Thrombotic means stationary, means the clot formed inside the arteries of the brain. It's stationary because it's attached where? To the wall. So now you're dealing with two problems. Fat deposit, and the second problem is what? A blood clot, right? You understand? So you have a blood clot there, and you have a what? A fat deposit there. Right? Okay, now, when does it become an infarct? When there is no more blood flow. Zero. What does zero mean? The blood clot together with the fat made it become completely what? Obstructed. When there is zero blood flow, there is zero what? Oxygen to the brain. What happens to the brain? It develops an infarction. And we learned that in the chapters on cell damage, right? Infarction means what? Reversible or irreversible? Irreversible, because the cells are dead. Right? You understand? Okay. So, thrombotic stroke, stationary. So, this onset of hemiplegia, you know what hemiplegia means? Half of the body is paralyzed. When the right side of the brain is affected, what gets paralyzed?
Left.
Contralateral side. Be aware of this. Be aware of this. In the nursing board exam, you will be asked questions that if you think it's for medical students. No, it's not. It's for nursing students. When I reviewed nurses for 8 years, I always tell them, think like a doctor, act like a nurse. In other words, you have to be as smart as your doctors, because you're going to be taking care of their orders, taking care of their patients, right? So, whenever you have hemiplegia, usually in the nursing board exam, they will ask, a patient was brought to the emergency room presenting with left hemiplegia. What part of the brain is affected? Of course, what?
Right.
The right side of the brain. It could be right frontal lobe, right parietal lobe, based on a CT scan finding, or MRI, okay? Always remember this, questions in the nursing board exam will have to do with what? Case scenario. So they would say, it's a case of a 70-year-old male patient who was brought with left hemiplegia. What part of the brain is affected? You would say, right. Why? Why would that be the case, my dear? So this is where the smartness comes in. It's not just knowing the right answer, but knowing why, where, what, and how. Yes. Why would it be, if you have left hemiplegia, why would it be the involvement with the right side of the brain, my dear? What is your name?
Julian.
Julian Resurrection. I can see your notes. Can I borrow your notes, please? Julian. Okay, so he has complete notes here. Very nice. All yellow marking. I hope it's not all yellow pages, you know. Some people, when they study, they put all yellow and everything becomes yellow pages. And when they take the exam, you don't remember. Here, at least you only placed yellow on the keywords, I presume, right? And I can see the red ink, maybe another important word. Okay, yes, my dear? So I hope the answer is in your notes here.
Because the neurons on the right side of the brain goes to the left side of the
The neurons, okay, the neurons. So the nerve cell transfers to the left? Is it the neurons?
No. The nerve.
Okay, take your time. I have all the time in this world. I can stay for 1 hour. No, I'm just joking. Okay, yes, my dear. Would you like to call a friend?
Yes.
Who is your friend here? Who can help you? Do you know her name? Do you know her name?
Diane.
Diane Roberts. Okay, Miss Roberts. So you have to prove to me that I called you Cerebral a while ago. Are you?
No, it's not
Cerebral?
neurons. It's not in neurons. It's nervous.
Why is it that, according to her, the right side of the brain controls the left side, right? In what way? Explain to me in anatomical terms. Now, if you don't know, it's okay. I will provide the answer. But if so, yes, Miss Hannah Dilling, yes.
The nerve fibers cross in the medulla.
Were you my former student in anatomy?
Yes.
It's a good thing you remember, right? This is the day of reckoning. Payback time. What you learned in anatomy will always come back, right? What did you say? The nerve fiber tracks.
Oh, the medulla.
Okay, they cross where? In the medulla oblongata, which is part of the brain stem.
Here.
Okay, over here. at the base of the skull. After the medulla is the spinal cord. The spinal cord passes to the foramen magnum of the occipital bone. See? When I taught this class on anatomy, I told them this was important for physiology and most importantly today. Today is the day that you can apply what you have learned. Okay? So apparently now let me see if you can go more than that. I compare this to what? Telephone wires, right? A telephone wire? How many of you have cut a telephone wire? When you cut a telephone wire, what do you see? A red wire, a blue, a yellow, white, black. Each of that wire goes to a specific what? Muscle. A specific muscle. A specific organ, right? So apparently, in the case of a left-sided brain or right-sided brain, left hemiplegia is because the motor fiber tracks, like a nerve fiber tracks. They originate from the frontal lobe, the precentral gyrus of the frontal lobe. You learn about that. From the right side, what happens to the nerve fibers? Like telephone wires. The telephone wire will travel on the right side of the brain. And where do they go?
Medulla.
In the medulla, they go to the left side of the brain, and they start to go down where? On the left side of the spinal cord. Which means the left side of the spinal cord, what do you call the nerves coming from the left side of the spinal cord? Spinal nerves. Don't you love anatomy? What do you call the nerve from the spinal cord? Spinal nerves. We have 31 pairs of spinal nerves. 31 pairs, one the left and the right. So the left side, remember the word brachial plexus and lumbosacral plexus? Brachial means arm. Those were groups of spinal nerves, C5 to T1. Those nerves will eventually end up what? Innervating each of these muscles here. Musculocutaneous nerve, biceps. Radial nerve, triceps. Medial nerve, radial nerve. So, if the right side of the brain is affected by a clot, will that affect the function of that brain?
Yeah.
Yes. So if the right side is affected, can you send a nerve impulse to the spinal cord and to the nerves here? You cannot. Without nerve impulses, without, which you learn in physiology, depolarization, then the muscles will never contract. They become what? Paralyzed. Hemi means half, complete paralysis. Now what's the difference between hemiplegia and hemiparesis? Hemiparesis, observe. Hemiplegia, move your arm. 0. Plegia means complete paralysis. Move your leg, you cannot. 0. 0 motor strength. Hemiparesis, partial paralysis. Okay? Now in thrombotic strokes, the onset of hemiplegia is gradual, and they call it step ladder. What do you mean by step ladder? It progresses upward like a ladder. Okay? Example. Honey, I'm a 70-year-old male. My wife is here with me. I complained to my wife at 10 in the evening. I said, honey, I was brushing my teeth and some of the water spilled on my left side of my face. And then I noticed my arm and leg is heavy. I can only do this. Okay, don't worry, honey, just go to sleep. At 1 in the morning, I woke up. Honey, it's getting heavier, honey. So instead of here, it's now at 1 in the morning, here, and then here. And then when I wake up at 6 in the morning, guess what? Honey, I can no longer move my arm. What's that? What kind of weakness is that? Step ladder. Gradual. What about embolic strokes? Okay, because there's no more time. The clot came from where? Where do you think the most common area where the embolic strokes come from? The embolus. The traveling. Yes? Gordita?
Heart.
The heart. Okay, very good. Okay, because I want you to think fast. Give me more specific than the heart. Which chamber of the heart? The what?
Left.
Very good. The left ventricle. Can it be the right ventricle?
No.
Why not?
Because the
Where does the right ventricle go?
stop on
Huh?
Lungs.
pulmonary.
Okay, the pulmonary trunk becomes pulmonary artery, go to the lung. If the clot is formed here on the right side, or it's formed in the leg veins, like your inferior vena cava leg veins, clots on the right side of the heart, but including the leg veins, vena cava, they all end up where? As a pulmonary embolism. Why? Because they get stuck where?
Lungs.
Why do they get stuck in the lung?
Because of the capillaries.
Of course. And what are capillaries, my dear? The smallest blood vessel. In fact, the pulmonary capillaries are so small that only one red blood cell can go through. Because the air sac is here, exchange of oxygen and carbon dioxide will occur. So what happens if you have a blood clot? It can't go move on. It gets stuck here. There's heavy traffic, not even heavy. There's a standstill. It's stopped there. It's called pulmonary embolism. How do you know? Two things. Chest pain with sudden onset of this difficulty breathing. So it can never be on the right side. That's one very important thing. In the nursing board exam, I've reviewed nurses for 9 years. I've observed that they will give you, especially nowadays, are you an LVN? Did you have an exam where you have pictures, not just multiple choice questions? You had?
Several.
Several, I like that answer. You took an LVN exam. What do you think will the RN exam be? More of that several things I told you?
Yeah, I believe yes.
And you don't only believe, it's 12!
It's true, yeah. And there are a lot of questions.
And then you have a
from
drawing
anatomy.
like this in your computer screen. It's a computerized test, by the way. It's called CAT. Okay? Computerized adaptive test. It will adapt to your level of intelligence. The smarter you are, the less questions they will ask because all your answers will be right. 75, you end at 75 questions, bang, you pass. If you're not from West Coast, your answers will right answer, wrong answer, right answer, wrong. So it can end up with 265 questions, right?
Oh my God.
Because they don't know what to do with you. You save a person's life, you kill a person. You save and then kill another person. Because you came up with the wrong nursing intervention, okay? So, apparently, therefore, you are given a drawing here, you will be asked, a patient with a cardioembolic stroke, where did the clot come from? So you draw a picture, then you, with the use of the cursor, remember the computer mouse? And there's a cursor that moves, the arrow. If you click here, the computer will say, oh my God, incompetent student, does not deserve to pass. Why? Because you click on the right side, which means that the computer will know that you don't know what your anatomy is. But if you click on the left ventricle, oh shit, this is from West Coast. I apologize for the shit, but he must be smart, or she must be smart, right? Because she came up with the right answer. What about left atrium? Still the same. It could also lead to what? A cardioembolic stroke. Now, what can lead to the development of a clot that travels here to become an embolus to the brain? Psh. What can lead to that? What are the usual common conditions that lead to the development of a blood clot in the left side of the heart? Give me one example.
Arrhythmia.
Huh? What?
Arrhythmia.
Okay, very good. Arrhythmia. What specific arrhythmia? Means without rhythm, right? What? Atrial fibrillation. No, I wasn't here. I was in San Francisco when we taught this topic. Remember? You have this kind of electrocardiogram. But you probably saw, so did you see my teach back on this? When I sang a song, A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, and me. We're gonna study the ECG. If you subscribe, it's there, okay? It's my rendition. The P wave, the QRS complex, ST wave elevation, MI and ST, okay? The bottom line, therefore, is that when you see something like this, the distance from one peak to the next peak is equal or the same. It's called regular sinus rhythm, RSR. Regular sinus what? Rhythm. There is no, what is without rhythm, arrhythmia. Okay? So what happens when you have an MI? That means the coronary arteries, which came from the aorta, has a fat deposit and a blood clot, just like in a stroke. So can it affect the SA node, the AV node, the bundle of His, the Purkinje fibers, which are part of what will make the muscles contract? Yes. So instead of a regular sinus rhythm, when you have an MI or ischemic heart disease, you end up with what? This is actually an MI. What is that? Flat line. What's a flat line mean?
Die.
There's no electrical stimulation, there is no electrical activity. Without electrical activity, then what is the next step? There is no muscle contraction. In order for the muscles to contract, you have to have an electrical or nerve stimulation coming from the nerve. In the case of the heart, where does the nerve stimulation come from? The pacemakers of the heart, SA node, AV node, bundle of His, Purkinje fibers. If those pacemakers are destroyed in an MI, or ischemic heart disease, then you end up with an arrhythmia. So from atrial fib, ventricular fib, from ventricular tachycardia to fibrillation, you have a flat line. Flat line means there is no electrical activity. That means you have cardiac arrest. The muscles will no longer contract. What do I tell the nurse? Code blue. Are you going to slow down and bring the crash cart? Everything I need is there. And I say, stand clear, I'm clear, everybody clear. 300 joules. If it's successful, if not successful, what happens? Stand clear, everybody clear, 300 joules. Another, stand clear, everybody clear. No response. Time of death, 7:30 a.m. August 3, 2018, West Coast Medical Center, North Hollywood, California. The bottom line is that, but this arrhythmia, as I said, can kill the patient, or if they do not kill them, can lead to what? A cardioembolic stroke. Why? Okay, I'll tell you why. When you have an arrhythmia, when there is continuous pumping action, there is no time for the blood to clot. On the other hand, when you have an atrial fibrillation, there will be times when you have a skip beat. So instead of it will be skip beats. So that period of time, it takes 2 or 3 seconds. What happens to the blood that is not moving at all? It will clot. When I was a young boy, I was born a scientist. The chicken blood. We put the blood of the chicken inside a container. 2 containers. One container, we leave the blood there. In another container, we have what? I would stir it with something. What happened to the blood in that container that was not being moved? It will coagulate. The same thing here, right? The same thing here. So apparently, if the clot is formed because what? You have a skip bit. So by the time you form the clot here, so the big difference is this. The onset of weakness here would be what? Gradual or sudden? Hemiplegia. The answer would be sudden. Why? Because the clot will travel immediately to the brain. That's why they have an onset of hemiplegia right away. Does that make sense? What is the common denominator between these two? A clot formation. What's the treatment? Giving of what?
Anticoagulants.
Will anticoagulants help at this point in time?
No.
Or should I give a thrombolytic drug? You know the difference of thrombolytic drugs, right?
Yeah.
TPA, streptokinase, urokinase. These are drugs designed to dissolve the clot. What's the problem? What do you want to do with the clot? Dissolve the clot. Anticoagulants like heparin or warfarin, do they dissolve the clot?
No,
they do not. What do anticoagulants do? They can only prevent further clot formation. Will this come out in the nursing board exam? 18% of the questions has to do with pharmacology. I told you, think like a doctor, act like a nurse. Does it make sense? What about aspirin? Is it an anticoagulant? It's a thrombolytic drug. Am I smiling? Which one is anticoagulant? Heparin and warfarin. Did I say aspirin? What is aspirin going to do? Huh? Well, the word blood thinner is used by high school students. Blood thinner is, I'm not trying to put you down, but the word thinning of blood is used by laymen. Eye doctors do not use, we don't say, we use blood thinners here. You as a nurse, you don't want to say blood thinner, because when you use the word blood thinner, that means your level of learning is not as sophisticated as a nurse. But it's okay, because when you talk to people, layman, you may have to use that word. They come, oh, I heard it's a blood thinner. But we use the word anticoagulants, right? They prevent further clot formation, because when a clot is formed, it's solid. That's why they use the word blood thinner. But we try to avoid, it's not like paint thinner, you know? You know what I mean? No, I know what you're trying to say, because that's what normally layman would say. And you might have to use that to explain to a young person who doesn't know anything about anatomy and physiology and pharmacology, right? Okay, what's the difference? Does anybody know? Anticoagulants such as heparin and warfarin, they prevent further clot formation, but they cannot dissolve the clot. What can dissolve the clot will be thrombolytic drugs like TPAs and of course the streptokinase. What about aspirin? Can anybody tell me what is aspirin? Remember? Yes? Okay, Google it. I'll give you 1 minute. What is aspirin? Huh? Anti what? There you go. The anticoagulant will act on the clotting factors. The aspirin will act on what?
The platelets.
Yes, what about the platelet? Salicylic acid. Is that another name for aspirin? Is that also ASA? Now, in the nursing board exam, you have to be aware that there are so many terminologies we use. When the doctor tells you, I'm going to give this patient acetyl salicylic acid, is he referring to aspirin? Yes? And what does this drug do? Anti what?
Coagulator.
Very good. Anticoagulants affects the clotting factors if you go into the mechanism of action. Remember, in clotting, you need two things. Clotting factors and then platelets, right? In the case of aspirin, it's more specific. Antiplatelet means if I have a wound like this, there's an opening here, like a gunshot wound or stab wound, the blood will extravasate, the blood will come out, right? How does the platelet help you? They will what? Remember the word aggregate? So the platelet here, the platelet there, they'll clump. And what do? They stay here. They form like a what? You know the word plug?
Plug, yeah.
Plug. So that the bleeding will stop. That is the role of the platelet. It helps the blood to clot, but in a different way. They clump together, they go here to stop the blood from coming out, to stop the bleeding. Does that make sense? Okay? Now, so these drugs, aspirin, heparin, warfarin, anticoagulant, antiplatelet, or antithrombotic drugs, thrombolytic can be given. Can you give that in a hemorrhagic stroke? No, why not? Because it can even make it worse. Does it make sense? Because what can those drugs do? Cause more bleeding. Do you understand what I'm trying to say here? My father suffered a stroke. He was 62 years old. What did he do? One morning he was what? Constipated. What do most constipated people do? They do this. Within 1 second, bam! Paralyzed on the left side of his body. He was brought to the emergency room. Guess what? He suffered a stroke. What kind of stroke did you think he suffered? Thrombotic or hemorrhagic? It cannot be what? Thrombotic because sudden onset of paralysis. Could it be cardioembolic? Maybe, but what did he do before he suffered a stroke? He was what? Straining. Strain. Because he was what? Do we want our patients to be constipated?
No.
No! What kind of diet are we going to recommend? High fiber diet. So are these questions like in the nursing board exam questions? So that's why when I say, every time you have a wrong answer, you just killed someone. And every time you kill someone, the chances of passing becomes going down, going down, going down. That's why every time you have 265 questions, you probably had right answers or wrong answers for your nursing intervention. So, my father suffered from hemorrhagic stroke. So what happened here? Hypertensive bleed. The blood pressure was 220/100 and he strained, bam! In fact, a month before he suffered a stroke, what did I tell him? I wrote him a love letter. Dad, I love you. I don't want you to suffer a stroke. That was in my residency training in the big hospital. I told him, if you're constipated, take a high fiber diet, fruits and vegetables, over the counter, stool softeners and laxatives, which will make you what? Make poo-poo. But never strain. Don't do this. Which he did not heed to my advice. Guess what? He suffered a stroke because he didn't follow it. So, hemorrhagic stroke. Now, what is the danger here? So the most common for hemorrhagic hypertensive bleed, right? What's another one? A ruptured what? Very good. Aneurysm. An aneurysm, if this is the artery of the brain, or any part of the artery, it could be aortic aneurysm. There's a ballooning of what? Of the wall. It could be congenital, which means we're born with it, or it could be acquired because of prolonged hypertension. The ballooning of the wall, what happens to the wall? It gets thinner. What happens if the blood pressure is not controlled? Or when you strain, it gets bigger and bigger, and then what? Rupture. You have bleeding inside the brain. What's another one? AV malformation. Arteriovenous malformation. What do you mean by that? Normally, if this is the artery here, or arterial, what connects the arterial with the venial? Very good, capillaries. In AV malformation, there are no capillaries. When there are no capillaries in an AV malformation, that becomes an area of weakness. Any sudden increase in the blood pressure, what happens to these? Can also what? Ruptured AV malformation. Do you understand? Will these questions come out in the nursing board exam? Absolutely. Now, are we going to give aspirin, anticoagulants like heparin, warfarin, and thrombolytic drugs here? No way! You're going to make it worse. Guess what happened to my dad? This was in 1988. There was no CT scan in the place where I grew up. This is a long time ago. You probably were not born yet. There was no CT scan. So what did the doctor of my dad, and I was a close friend of hers, she based it on what? What's the most common type of stroke? 60% of strokes are thrombotic strokes because of atherosclerosis. So she relied on statistics rather than looking at what? What my dad was doing. That's why in medical school, we were taught 90% of treatment is based on your what? History taking and physical exam. What do you mean by history taking? You ask, what happened here? What happened? Sudden onset of weakness, 1 hour prior to admission, because what was he doing? He was training because he was constipated. That alone, without a CT scan, will already tell you that we are dealing with what kind? A smart doctor would have said, this cannot be thrombotic, because thrombotic would have been gradual, right? Honey. But he was sudden onset, he strained, his blood pressure shoot up, bang! And the problem was that because the doctor had the wrong diagnosis, did the doctor give aspirin to my dad? It's the most stupid thing to do. But I can't blame him, her. So I went home. He called me one day. Monday I came home. Tuesday I saw my dad. He was not improving. I had to airlift him to a bigger city where with a CT scan. So I brought, of course, I had to use a commercial airline. And then the CT scan showed that it was massive bleeding in the brain. We had to drain the blood, but the doctor said it's too complicated now. They just conservative treatment. And somebody will talk about stroke, right? I don't want to go into the details. Aneurysm and all this, if it's diagnosed early, it's good because you can do something. Like clipping of the aneurysm, do something, or coil, and hope somebody will talk about it later. The bottom line, therefore, is different diagnosis, different treatment. Here we give anticoagulant, aspirin, and thrombolytic drugs for clots. Here we never give those kinds of drugs. Okay? Now, which do you think has increased intracranial pressure? Bleeding inside the brain or brain swelling due to this? Both of those will increase the intracranial pressure. Why? Okay, everybody do this to your heart, skull. The skull is what? Hard, right? But the brain is soft. When there's bleeding inside the brain, the blood will occupy space. Whenever the blood occupies space, it increases the pressure inside the brain. So what happens to the brain? It will be what? Pushed upwards or downwards? Downwards towards the foramen magnum. There's a hole. That is the area of least resistance. So when the brain's pressure is increased, intracranial pressure is increased, the brain is pushed downwards to the hole where there's least resistance. What happens to the medulla oblongata?
Squeeze.
Medulla is here, spinal cord is there. Medulla here goes down, it's squeezed compressed by the foramen magnum, which is bone. If you compress the medulla oblongata, what happens?
Respiration.
Yes, Ms. Roberts?
Respiration problem.
What will be more specific, the respiration problem?
Patient cannot breathe.
Okay, respiratory arrest.
Arrest.
You stop breathing.
Stop breathing.
So be precise with the answers, okay? You stop what? You stop what? You stop what? Then you will rest in 6 feet under the permanent resident at Forest Lawn. Permanent resident. That's why when there is bleeding, like somebody will talk about traumatic brain injury, we have to do a craniotomy immediately, right? Do you understand what I'm trying to say? So we are in the profession of saving lives. Doctors and nurses are here to help. But we need you to be as smart as you can be. Now that doctor was not smart. She gave my father an aspirin because she thought it was thrombotic. No, but it's not an excuse. With or without a CT scan, you can learn by using the history of my father. He was hypertensive for 20 years, and he was training, and obviously his blood pressure went up. He had hypertensive bleed. Do you understand? Okay? Now, in patients with multiple sclerosis, what's the problem there?
Demyelination.
Okay, demyelinating disease, right? Okay. And apparently here, the problem has to do with the myelin sheath. What is the color of myelin? It's white. It is found in what? It is the neuron here, cell body, axon, myelin, right? The reason why it's better if you have myelin in white matter because the nerve impulse will what?
Yeah.
Node of Ranvier, the nerve impulse will what? Jump from one node of Ranvier to the next node of Ranvier in the brain and spinal cord, including the peripheral nerves. MS affects the central nervous system, which means brain and spinal cord. It's a form of what? Autoimmune disease. What do you mean by autoimmune? Your own immune system
Working
attacks
against you.
the brain's myelin. So what happens now? The nerve impulse becomes what? Slower or absent. Autoimmune, right? Usually affects women between the ages of what? 20, 40, middle age. Some would say 20 is not the middle age, maybe young adult, but I don't care as long as it's a young woman. From the ages of 20, 30, 40, 50, MS. Now, can it also affect men? Yes, but mostly women based on these kinds of autoimmune disorders, right? And what else is present in these conditions? There's periods of exacerbation and remission. Can anybody explain what that means? Anyone? Did you recall that in your readings? Periods of exacerbation and remission? Yes, Miss Angela?
Remission is when
Huh? What do you mean by exacerbate?
Make worse.
I'm asking. Okay, I will give you the table to you, okay, or floor to you, yes. Exacerbate means what?
Make worse.
Make worse, but at the same time, it's when the signs and symptoms are manifesting. In remission, 0, you're normal. Exacerbation, remission. Exacerbation, remission, okay? So you have relapsing episodes, right? Okay, you have optic neuritis. You can become blind in MS. If it affects the spinal cord from the waist down, you become paraplegic. If it affects the spinal cord at the cervical level, you become quadriplegic. Or it can affect the left side of the brain, you can become hemiplegic. That's why some people think that you suffer from a stroke, but in fact it's not a stroke. Right? Do you understand? Does that make sense? Okay, now, what about Parkinson's disease? What is the neurotransmitter that's lacking here? Dopamine. Dopamine is produced where? Miss Salcedo? What's your last name? Yes, Miss Salcedo. Where is dopamine produced?
it's
Substantia nigra. Nigra, black, substantia, black substance. It is because it's pigmented, right, in the brain. It's produced there, but it's stored in the what? Basal ganglia. The caudate nucleus, putamen, and globus pallidus. Now you might say, do I need to remember all these things? Well, the more you know, the better for you. Knowledge is unlimited. Learning is unlimited. With all this, you're so lucky. You millennials, you young people, at the tip of your fingertips, I can study with this. I can just Google while waiting for my boyfriend or girlfriend. There, you can see my hand. I'm trying to check if the one I'm... You want to know what I mean? There you go. That's my voice, my ugly voice. Okay. 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 So the bottom line, therefore, is that dopamine is lacking, right? Now, the question is, what does dopamine do? So this is always the thing you ask yourself. How can I become a smart person? I should always ask myself, why? What? Where? How? Where is the problem? In the substantia nigra. Why? It's not able to produce dopamine. Now what? So what if there's no dopamine? In other words, what does dopamine do? Why would there be problems in Parkinson's disease? Anybody? Do you ever ask yourself those questions? If I am preparing for a quiz, an exam, whether it's nursing board exam or the quiz today, I have to ask myself, what is it that I need to know? I'm not just going to be here to pass an exam. I want to perfect the exam. Since I was a 10-year-old boy, that's always my, unless you got distracted, you know, with women and all these things. Your goal was always to be what? Get a perfect score in anything you do. The same thing with you. When you go to core nursing, you always want to do your best, believe me, so that you will have no problem passing the nursing board exam, so that you can pay your student loans eventually, right? Okay, anybody? Yes? What does dopamine do? Okay, I'll answer my own question. Dopamine is a neurotransmitter that is inhibitory. What do you mean by inhibitory? It stops. What I mean by, for example, if you lack dopamine, you cannot inhibit what? Your motor function. You cannot inhibit. That's why you end up with what? Tremors. Right? Tremors? Number one. Number two. What kind of gait do they have? What kind of gait pattern? We're going to talk about Parkinsons.
Bradykinesia.
Huh? Yes? Hala? Fascinating or shuffling gait. Know the spelling. F-E-S-T-I-N-A-T-I-N-G or shuffle. Shuffling gait. So they walk like this. What else? So when I ask what kind of gait pattern, shuffling gait, fascinating. You mentioned about bradykinesia. Is that the answer to my question?
No.
No. Why did you say bradykinesia?
When they're moving, it's a bradykinesia.
There you go. So that was not the answer to my question.
No.
My question was what kind of gait? The answer is shuffling gait. Now, this fine. What is bradykinesia, my dear?
When they're taking.
What does Brady mean? Brady.
Brady, it's made low.
Slow. Kinesia means what? Joint movement. So look at me. Look at me now. So I have tremors, I have shuffling gait, and then what?
Slowly moving.
Tai Chi. I'm just joking. Slow movement, right? And you ask them, Muhammad Ali has Parkinsons, right? Muhammad. Slow. What about the facial expression? Zero, none. Mask, it's called mask. M-A-S-K. Mask faces or faces. F-A-C-I-E-S. It's called amphibian stare or some books reptilian, but I disagree because I'm a zoologist. A frog is not a reptile, it is what? Amphibian. Amphibian, right? Okay, so what does a frog do in the pond? The frog goes like this, right? What is the frog doing? Waiting for the food, right? Is it blinking? No. Is it moving its lips? No. So when the fly goes here, there is no facial expression. Mask, M-A-S-K. Like Muhammad Ali. He used to be what? Float like a butterfly and then what? Sting like a bee. But guess what happened to him? With repeated trauma to his head, he developed damaged basal ganglia and substantia nigra. So what do you think is the treatment for this patient? What will we give these patients? If you lack dopamine, you give what? Levodopa. Don't you love anatomy and physiology and pathophysiology?
And levodopa.
Problem with levodopa is that it's only good for the first 2 or 3 months. Afterwards, no effect. Useless. So we at the J. Gamo Foundation Research Program, we're trying to find out what are the better medications, the treatment plan, right? Or they do a lot of brain stimulation now, okay? Now, what about Guillain-Barré syndrome or GBS? GBS, right? You know what GBS, right? Guillain-Barré syndrome, what is that? It's a form of what? Another form of demyelinating, that's like MS, but in MS it affects the brain and spinal cord. Here it affects the peripheral nerves.
But it's going up.
Okay, very good. Ascending paralysis. So what's paralyzed first would be the feet. Then the paralysis extends to the leg. Ascending means to go up. Then the thigh, then eventually here. What muscle is important for breathing? What nerve innervates the diaphragm? The phrenic nerve. So the moment you have involvement of the phrenic nerve and the diaphragm, when the diaphragm becomes paralyzed, you go into respiratory arrest, you stop breathing, you die. And I had a sad experience there. When I was making rounds in 1994 in one of my patients, I saw the patient in the intensive care unit. I told the nurse, come here nurse, can you take a look at the patient? The patient was using abdominal muscle breathing. You don't do that, right? You only, here, right? Diaphragm and intercostals. To cut the story short, I told her we code blue, intubate, because he was in severe respiratory failure. But the nurse failed to recognize that. when the nurse fails to recognize somebody in distress, will that patient die?
Yeah.
That is what happened to this patient. The patient died eventually. I feel bad. When I made rounds the following day, the bed was empty. Why? Because the patient was already dead. Why did I feel bad for the patient? I'm not trying to blame the nurse. Maybe it's everybody's fault. Because when I came in, there should have been what? Doctors there monitoring the patient. He was a 20-year-old male with GBS. I feel bad for him. I don't know where he is now, bless his soul, but that could have been prevented, because if we could only intubate him and hook him to a ventilator or breathing machine at an earlier time, he could be alive today. Do you understand in GBS? Okay? Now, arthritis. What does arthritis mean? Inflammation of the joint, right? So apparently here, again, use of concept maps, or you can use a table. Either it's not a concept map, a table. So if you say arthritis, right? Arthritis, you can either have what? OA, is osteoarthritis, and then what? RA. We just think about three. Gout. Arthritis. Here in gout is easy because it's deposition of in the joint of what? Uric acid crystals, right? And what do you call those deposits of uric acid in the skin and in the soft connective tissue? What is it? Very good. Tophi if it's more than one, tophus if it's one. Tophus is singular. You can see them on the big toe and all this. Gout usually affects the big toe, right? They say gout is the disease of the prince and the king because they like to eat a lot of food that contains purine and pyrimidine, you know. But it can affect anybody like you and I, right? Can it affect the kidney? Yes, remember we talked about this kidney stones, gout, leading to gouty nephropathy. But what is most painful is what? Arthritis, because why? Imagine getting a glass, you know, any glass, you break the glass, put the glass crystals into your joints. Will that be very painful? Yes. Now, osteoarthritis, what is the pathology? Where is the problem? Where is the problem here? Yes, Ms. Canal?
Articular cartilage.
Okay, very good. What about in RA? Anybody? What is the pathology? Where? See, remember I told you this? Ask yourself, what is the pathology? Where is the pathology? Why is this happening? What is the pathophysiology here? Here it is what? Synovial or synovial membrane. What does the synovial membrane secrete? Synovial fluid for lubrication in the joints. Is this autoimmune?
Yes.
Very good. So that means you had a prior viral or bacterial infection. Your antibodies were produced against the virus, which is the antigen. But the antibodies and your own immune system now will not only attack the virus, but also attack what? Attack the synovium to become inflamed. You have synovitis, right? Can anybody tell me what is the chronic lesion seen here when there is synovial membrane inflammation? Yes, Ms. Canal?
Panis?
Oh my, where did you learn that word panis? Huh?
Your YouTube video?
I said that? Oh my God. Okay. How do you spell panis, Ms. Canal?
PNNUS.
Okay. Panis. It's seen in rheumatoid arthritis patients. If you do a biopsy of the synovial membrane, it's very thickened. It's because of chronic irritation and swelling. Panis formation. Now here, articular cartilage, the main problem is what? Weight bearing, and then what? Wear and tear. Right? Wear and tear. Right? Wear and tear. What does it mean?
Too much use.
Too much use because of weight bearing like me. Which are the weight bearing joints that I have? The knee, the hip, right? The spine. So what happens if I gain weight? If I'm 300 pounds, will that affect weight bearing?
Yeah.
So we always tell them to lose weight. In fact, many of these patients end up with what? Deformities of the knee. Right? You understand what I'm saying? Have you ever seen these women walking like this? Like a rhinestone cowboy. What is that called? Knock knee or bow-legged? Bow. What about this one? What is that? Knock knee, right? Okay. There's a scientific term. We don't have to tell you that. Knock knee. So this can happen, and we have to do surgery on those knees. Can we do surgery for the hip where there is osteoarthritis? It's called hip replacement. Huh? hip arthroplasty, especially if the joint space is narrowed because of complete damage to what? Articular cartilage, when we have to do hip replacement. Oh my God, there will be a lot of questions on that. My favorite topic, hip replacement. Amazing. What should a nurse do and not do? So believe me, this question that you'll be encountering in the nursing board exam, what is it that you know that will save a person's life or prevent any complications? Hip replacement for severe arthritis of the hip. You understand what I'm saying, okay? Articular cartilage, synovial membrane, autoimmune. Now, why is this symmetrical joint involvement? If you affect the left knee, it will also affect the right knee right away. Left knee, right knee, left elbow, left elbow, right elbow. Why? Because why? 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 Autoimmune. What means the antibodies are found where? In the blood. So if the antibodies attacks the left elbow, it will also attack the right elbow at the same time. That's why here it's called what? Symmetrical joint involvement. Does it make sense? Does it make sense to you? Unlike here, the knee, today, after 6 months, the left knee. So it's not at the same time. Because there's nothing in the blood that will go to the joints at the same time. It's more of wear and tear, weight bearing. Okay? It's called degenerative joint disease, DJD. DJD means what? It's because of getting older and wear and tear and walking with those joints. Okay? And we do a lot of repair. Hip replacement is one of the more common ones. For the knee, there's a knee replacement and hip replacement. It's called hip arthroplasty. Isn't that amazing, right? Do you understand? Now what else? Now, in gout, it's just what? Uric acid crystals. And I don't know if somebody was assigned to talk about this. We make use of lots of medications for this, right? For pain relief, NSAIDs, and then allopurinol, and of course, colchicine is the treatment of choice during the acute attacks of gout. Can this kill you? You can develop kidney failure. The joint pain and swelling will not kill you, by the way. What will kill you is the chronic kidney disease due to what? Gouty nephropathy, which causes kidney failure due to the deposition of what? Kidney stones. Okay? Can anybody tell me what is the term used when the big toe is involved, it becomes inflamed and swollen? It begins with letter P. Okay, so research, one minute research, Google. That's why we don't let you have your cell phone during the exam. Does anybody know? The more you know, the better for you. Big toe joint swelling in patients with gout. So gout, big toe swelling. It begins with P and ends with A as in apple. P as in Papa, first letter. Last letter would be an A as in apple. Yes, Miss Canal, what did you get? What are you using?
Big toe joint.
Miss Din? Who was the answer? Yes? Is that how slow Google is? Or Bing? Yes? What's the answer? Big toe, swelling, gout. Just type the words. Anybody? Let's see if I do it myself. Let me see if I come up with the answer. Anybody what's the answer?
Podagra.
Yes, you say my ATP, you know. What did you say?
Podagra.
How do you spell it?
Podagra.
How come he got it and the rest of you did not get it? What words did you put there? Huh? Colin?
Gout, big toe.
Gout, big toe. Okay, so I just put gout, big toe. Okay, so see, 3 words: gout, big toe. Well, yeah, you're right. But I said also gout. Right? Put gout, big toe. Maybe I just right. Okay, there's a point there. So now, so be aware of these things. Okay. Okay, I'll give you a short break of less than 5 minutes. Go to the restroom. By 8:10 exactly, I will have to give the quiz. Okay. Yes, ma'am.
What was the name of the toe I didn't bring here?
Podagra. P-O. Papa O. D as in dog. A-G. G is God. R-A. Podagra. It's not Viagra, okay?